KFSR and CMAC present the Central Valley Ledger, a public affairs program featuring stories from all over the Central Valley with Sevag Tateosian, 90.7 KFSR.
I'm your host, Sevag Tateosian. Welcome to the Central Valley Ledger. We're recording out of the beautiful downtown Fresno studios of the Community Media Access Collaborative, Fresno and Clovis. We're going to be talking to Michael Goldring. He is the president of the Valley Children's Medical Group. Did I get that right?
You got it right.
Welcome to the program.
Thank you.
So as I'm driving down the 41 up the mountain, I see this beautiful facility, probably to the north of the 41. What is that facility?
So the one you're seeing is our main campus facility. It's a 358-bed acute care children's hospital.
And so how far is it from where we are right now?
13.1 miles. I actually timed it because I used GPS to get here.
So tell us a little bit about yourself before we get into your role in the hospital and a very cool art project you're doing. Tell us a little bit about yourself.
So I was hired by Valley Children's Hospital about 3 years ago to help them form and establish a medical foundation, which is a specific way of collaborating with physicians to provide care associated with a children's hospital. And part of it includes primary care, specialty care, and now it includes OB/GYN services. And it's a medical foundation for which we're providing services up and down the valley throughout our entire 45,000 square mile service area.
Do you have partnerships with different hospitals? I mean, I know that we're going to be talking about one in Bakersfield and Modesto, but talk about your partnerships.
We're partnered with most of the healthcare providers in the Central Valley. I mean, locally we're partnered with St. Agnes Medical Center. We have a level 3 NICU there, or a neonatal intensive care unit, and a smaller level 2 NICU with level 2 beds. We're partnered with Clinica Sierra Vista in Fresno, and we're collectively building 6 school-based health clinics with Fresno Unified School District, and we'll be doing more of those as things move forward. Just to the south of us, we're partnered with Aventis Health, where we have another level 2 NICU that's actually Valley Children's beds. And we staff their pediatricians in their clinics. We also are down at Quia Delta, just going a little bit to the east. And with Quia Delta, we provide their pediatric hospitalists, their pediatric neonatologists, and also a pediatric cardiologist. And then you go south there, we're partnered with a number of hospitals, Sierra View Hospital in Porterville, Delano Regional Medical Center with clinical partnerships. And then you get down to Bakersfield and we have some other partnerships with Dignity Health.
I know we can
Yes.
do probably 10 shows on all these partnerships,
Yes.
but briefly, when you're partnering with these facilities, what does that look like? I mean, are they referring patients to your facility or are you providing expertise to them?
So the vision of the hospital board and our CEO, Todd Centropak, was really to find a way to make sure that there are pediatric services that are somehow associated with Valley Children's Hospital within 30 miles or 30 minutes of every child in the valley. And it requires a collaboration with many of our partners. And our goal is with clinical partnerships is to help educate and provide support services for the respiratory care services or what it looks like for the nurses when they have a child that comes in presenting with an acute condition. We have telemedicine as part of this. And in many cases, we're providing staffing of hospitalists or pediatric intensivists or other services because the goal is really to keep kids at home, not transfer them to Valley Children's unless there's a greater need.
And then there's I believe I saw one time a helicopter landing in your facility. So there are times when you all need to helicopter someone in.
We actually have the busiest pediatric transport service in the state.
Interesting.
And that helicopter is flying in and out every day on multiple visits. You can feel the whole building shake when it's coming in. I mean, we're on the verge of maybe needing a second one with the amount of the children that are being transported to and from the hospital.
Tell us a little bit about, you were a lawyer before you became president of the group. Talk about the area of law you practiced.
So I practiced healthcare law, and I was I had many clients, many of the health systems in the Valley, mostly the medical groups, the large medical groups, the independent practice associations, or some of the multi-specialty groups, and I did that for 25 years. And very supportive of Valley Children's. I have a complex child myself, so I know Valley Children's intimately. I've spent many a night inside the PICU, the NICU, and various wards there, sleeping. And it had always been my charity of choice. And 3 years ago, I was approached by the CEO and said, I have a grand vision. I want to make sure the kids throughout the Valley have the same opportunity as the kids locally. And we need to get out there and really make it happen. So, like I said, the board and Todd made it all happen, provided the resources, and actually we're executing. I'm pretty excited about it.
Your background in law must come in handy in your role. Share with us a little bit about that.
Well, it does, because a lot of what I did was bringing people together and doing types of transactions. There were many acquisitions that we did, partnerships, and there was, in healthcare, you can't do it alone, as you know. Just with the county health departments and the insurance companies, the other hospitals, school districts, we're all trying to build a better and healthier community. Did a lot of that, and working with many nonprofits and for-profits and trying to provide better care. It's a big percentage of our GDP now. I mean, we're approaching 20% of our GDP that's involved in health. So there's always transactions and relationships being formed. And the Valley's got more challenges than many geographic areas, and it required those kind of deals. And I was a deal maker.
Well, congratulations on joining the Children's Medical Group, Valley Children's Medical Group, as their president. It sounds like there's a special place in your heart for Valley Children's because of your experience as a parent. Why is it important for other parents to get involved in the different hospitals?
Well, I mean, it's the parents that they drive the vision, they drive the need. Their feedback is essential to us, making sure we can provide those services to improve ourselves. You need that constant feedback. Every child that comes to us, we contact their parent to say, what can we do better? How can we improve? What did you like? What didn't you like? And that's really important we do that. We have a family advisory committee. We have committees and groups that meet for each of the specific conditions. The adult survivors of cancer, the adult congenital heart kids, the kids themselves, the children with cystic fibrosis, and some of the other children with very complex diseases.
You know, your role, you help a lot of people in your role, but it could be challenging as well because it's tough to see a child struggle. I mean, you know, why do you do what you do?
Well, I actually, it's the doctors and the nurses and the staff that does that. I'm actually the administrator behind the scenes trying to facilitate that. And, you know, sometimes as administrators, we lose what our doctors and our nurses and the rest of the teams do. But I can tell you, every day we go down in the cafeteria and you could see a kid riding an IV pole being pushed by their parents. Or you see kids wheeling through the hospital in their wheelchairs. And they have big smiles on their face. I'm amazed at children. You know, children with cancer. You know, they completely, they don't even think about it. They're still kids. They're playing. And you watch that and you think of the stuff you do day to day and you kind of facilitate it. I mean, it really is the easiest job in the world when you look at it.
So I got something in my email that you were looking for artists and artwork, and I thought that would be a perfect reason to invite you. Another perfect reason to invite you is your children's hospital and your involvement in the community. But tell us about the art, first of all, that you're looking for.
So we're looking for all sorts of medium. And so we went through this in the hospital for the last 2 years. So we've replaced all the art in the hospital. The original art was, it was older and fading, and we were looking for more playful art. And the team that did that did a great job. We have We have acrylic sculptures. We have benches that are sculptures, designs. We even have a full-size cow there that was done with concrete, with a dog looking at it, with realistic-looking water, and you go down the hallway. To me, it's a seminal piece of art. And you go to different parts of the hospital, and you're in different zones. You get one that's all aircraft. You'll go to another one that's all butterflies. You go to another one that's all Yosemite locations. So it's kind of cool. You're in a serious place. There are sick children there, and a lot of people going through struggles, and it's a diversion. So it's an opportunity to provide diversions in all these different zones, and that's why we did it at the hospital. So as we open up these regional specialty centers, and the ones we're made the call out for in that particular email you received, we're opening a large regional life center up in Modesto and another one in Bakersfield, about 50,000 square feet each. And we want local artists to participate. Bring us some playful sculptures, show some of your photography. There's a doctor down in Bakersfield who we work with, Dr. Bustamante, who's a genius on putting together displays with seashells and dinosaurs and all sorts of fossils. And that's the kind of stuff we're looking for, just exciting stuff that will pique the interest of kids and hopefully for a moment take them away from what's going on and recognizing there's more here than just a place to treat your sickness.
So you don't have a set by art, I thought you were just looking for paintings or drawings, but hearing you talk, it could be any form of art. You don't have a set like criteria, it sounds like.
No, I think they're going to look at it, and I won't be part of it. I'm the least artful person you'll ever want to meet. But there will be a group that's looking at it, looks at the proposals, gets an idea of the art, see what fits together, and they'll put together something that is very kid-friendly.
Now, are you paying the artist, or is this a volunteer effort? Tell us a little bit more about that.
I think there'll be a combination. It depends. Often we receive many, many donations. In the appropriate cases, we'll be paying for art. Fortunately, over many years, artists like to have their art in a children's hospital and children's facilities, so I suspect we'll get quite a few donations also as part of this program.
How cool is that? If I was an artist, I would love to get my piece in the hospital, because not only are people going to see it, but it might help a child or a family kind of get their mind off of things, right?
It happens all the time, and the kids do have favorite pieces of art. So you can watch a kid that they're running down the hall and they're dragging their mom or dad, come and see this piece of art, or look what's on the wall. Look at the hawk that's on the wall. Look at the picture of this fox playing with its is it fox cubs? I'm not sure what small foxes are called. So we have that kind of art, but there's all the different places. So the kids really get a lot of joy out of it. And I'm sure as the artists walk through the hallways, they do get the joy out of the kids having fun with their art.
So you're looking for art for two facilities, Bakersfield and Modesto. Tell us a little bit about your Bakersfield facility.
So Bakersfield is an area, we receive many children from Bakersfield. They have a choice for their health care, whether to go south or they go north. It's easier to access Valley Children's. We've had a long-term relationship with Bakersfield hospitals at Dignity Health and some of the doctors down there. And what we opened up about 2 years ago, a specialty clinic. In the specialty clinic at day one, we were overwhelmed with the need down in Bakersfield.
The need.
So there's huge needs, and Bakersfield had very few pediatric subspecialists. And we recognized the need, and the board, again, working with their partners down there, said, help us support this, see if we can make something better, provide that access, get to that 30-mile or 30-minute Valley Children's site. And we evaluated, and the market has a high need for many children. They're projecting 40 to 50,000 visits down there, which requires a very large building.
I'm going to stop you right there, and I just want to make sure that I heard you clearly. 40 to 50,000 visits.
Yes, over a period of time as it builds up. There's a great need and a great need for additional pediatric specialty services and a limited number of providers to provide that. So we need to staff that and hire the physicians, and the staff and the support services to take care of that. Because if we could provide that down in Bakersfield, the family doesn't have to drive 90 minutes to 2 hours to get to us. They could be provided down there.
Sounds like a great model. Tell us about Modesto now.
Modesto, similarly, Modesto will be a slightly smaller facility, and we're open. This would be the Modesto the Pellendale Specialty Care Center or Specialty Life Center, and we're going to be breaking ground on that next Saturday. And we'll have we'll be breaking the dirt with the shovels and making that happen. Same type of issue. There's very few pediatric subspecialists up there. Valley Children's has been up there for 20 plus years. One of our senior physicians, who is one of my daughter's personal doctors for many, many years since she was born. My daughter's now 24. Dr. Prohaska has been going up there with a pediatric cardiology clinic. He's telling us at least older than my daughter. So we know it's been for 24 years. We opened a earlier site in Modesto. We outgrew that. We're in a current site. We've outgrown that. And we have to build and take care of it in order to take care of the kids. Because if not, the kids, again, have to leave the area, which is really a suboptimal result.
It sounds like your facilities are all busy. Has it always been that way? Or has there been like the past few years where things have grown tremendously?
So there's a high need. We've got less pediatric subspecialists, pediatric services per 1,000 children in the Valley than many areas in the country. So it seems anything when we open and as we add additional capacity, that capacity is almost immediately consumed by the need.
Tell us about the giraffe. You know, there's this very popular giraffe that is actually on your card.
Yes.
But we every time there are times where I see this giraffe at events too. Tell us a little bit about.
George is very popular. So George Giraffe has been the mascot for many years with Valley Children's. I'm not sure when he first became the mascot, but George goes to many events, and George is a big kid. And George does a lot of kid things. And every child that comes to our hospital is his friend. So, and we try to make it like that. So when the kids see George, they know they have a friend, and they'll be intimidated by everybody else, but if George is walking around, they'll run up and give George a hug. And George, as a member of the animal kingdom, per body weight has the biggest heart in the animal kingdom, because you have to pump that blood up that long neck to the head to make him work. So, because George also has the biggest heart, and he's got the biggest heart for the children we serve.
George, the kids love George, like you
Yes.
said. And when I used to work at United Way years ago, we had an event for kids every year where we would bring them out and they would learn how to exercise right over at Fresno State. George would come out and everybody would jump on George, and he was the most popular person or thing at the event.
Yeah, so yeah, George is George has a caretaker that walks with George to make sure George is protected now. So George is always he's very popular, and it's been a great Valley icon.
So tell us a little bit about your day. I mean, we were talking a little bit off camera, and
Yes.
you had mentioned that, meetings started at 7, another one, and another one, and another one. Tell us a little bit about your day. What does your day consist of?
Well, it's a combination of meetings with the physicians that make us what we are, the inpatient side, the outpatient side, how we can make things better, how can we increase access, shorten wait times. I mean, I think what everybody is struggling in healthcare is to provide a better job, seeing how we can help our partners and support their services, what kind of training programs we can put out there. Recruitment is a part of every day, because no matter what we do, we need to continually recruit the experts we need to do to take care of the children in the Valley. So that does consume a good portion of the day. Today we also have some fun stuff. There's an interdimensional. I'm getting this wrong. Interdisciplinary conference going on downstairs in our big conference rooms, where we're having nurses and others coming in from all over the Valley, where they're learning from experts in their field about improving services. So that's a part of it. I got to watch part of that today. It's Nursing Awareness Month, or?
Yeah, it's Nursing Awareness Week, and then Nursing Awareness Month, I read as well.
So there's events going on all over the place, and we've got the greatest nurses. So there was an awards luncheon for them today. So yeah, it's always working. Then you're going to Starbucks and you're laughing with the kids that are in line, or they're in their wagons and just being kids.
Speaking of nurses, there is a nurse shortage in our area. I know because at the public health department, we have vacancies for public health nurses that seem to always be there. At the hospital, is that the same too? Are we seeing a need for nurses?
Nurses are increasing their scope of practice, and there's a lot of call for nurses. I mean, you're seeing it at the public health department, you're seeing it in pharmaceutical companies, you're seeing them among all the providers throughout the valley. It seems like we can't get enough nurses to support all the need we have, and we do have that challenge. We have some great things going for us. We're a magnet nursing facility. For many years, I think we were the first pediatric hospital in the west of the Mississippi to have gotten that designation. We've continued that designation continuously, which really involves highly engaged nurses. Our nursing engagement is really high, and we recognize how important they are, and we could not do it without them. I mean, that is our limiting factor, is making sure we have enough nurses to take care of the kids. We have nursing ratios. So typically for pediatrics, it could be 4 to 1, it could be 3 to 1, it can be 2 to 1, and as you get an acuity level, you can have situations where you have 1 nurse per patient. We put a child on ECMO, which is about the highest level of care you can provide. You might have 2 nurses in the room with an RCP and with a perfusionist, and the doctor standing by. So they are absolutely essential to everything we do.
Sounds like such a critical role, especially if you're talking about the cases where it's 1 nurse to 1 patient.
Yes.
That means that patient has some serious things going on.
Very much so, and the amount of technology and the coordination between the doctors and the perfusionists and the RCPs, the respiratory care providers, on these very complex kids. If you go into their rooms on the real acute areas in the ICUs, the PICUs and the NICUs, you'll see on either side of the bed what it looks like a traffic light, where you've got 20 drips on one side and 20 drips on another, and just monitoring that and making sure they got the right dosing. And the lines are at the right height as they're measuring things. We just can do so much more now, but it does require, and the level of training the nurses have to have is amazing to make all that work.
Every time I see a Valley Children's commercial, it's always upbeat. It's always like, fun, upbeat, kids having a good time. But deep down inside, there are some serious things impacting our kids, correct?
Very much so, yes. So, well, I mean, we have the medical conditions. It's amazing how fast kids can heal, or they'll get over their pain. They can be distracted. They kind of don't typically crawl within themselves when they're sick, because kids are supposed to be well, and that's their default state. So they can get there quicker. But the challenges children face in the Valley are pretty overwhelming. I mean, the poverty we deal with, and so the food insecurity, the lack of basic resources for some of the children. And we do get all these children. I mean, 3/4 of what we see in the hospital, the children that come to the hospital, are on Medicaid. So there is that high needs. We have many, many languages at the hospital that are spoken, primarily English and Spanish, and then just about everything else. And so they've got the language insecurities. Often we'll have the older sibling of a child interpreting between the parent and the care providers. So you have a 10-year-old that's in there that's helping you kind of provide some of that information going back and forth.
There are some people who say, you know what, my kids are healthy, everything is good for me. Why should I care about all the other kids and all the other community members? I have my own struggles. We work, we have our own families. Why should we care?
I think if you don't, so this is me personally, I mean, if you don't take care of the most needy, and the most needy, I mean, that's your children and your older population. I mean, what are we doing as a society? And from a pediatric side, if you're a parent, your life can change in a moment. And you will very much appreciate a children's hospital and the need for that there. I mean, it's a very expensive resource that's have there sitting and to be supporting, but imagine if we didn't have it and that event happened, you'd lose your child and they would suffer a very serious disease. And I think it's like anything else. You need to have the resource there to be able to take care of those moments.
So in a world where we don't have Valley Children's Hospital, Would we lose kids?
Absolutely. Absolutely. We have children that are transferred to us locally that are birthed in some of the other hospitals, and without emergency surgery emergency cardiac surgery on some of these kids, they won't survive. There are kids that are born with heart defects that are cyanotic conditions, meaning they're not getting oxygen. Unless you go in there and you operate immediately, the child won't survive. There are other conditions like gastroschisis where you have part of your insides that are out, you're born with outside that needs to be immediately corrected, but you can get restrictions or necrosis and things like that. If you don't get in there and correct that immediately, you have problems. If your esophagus isn't connected, you'll have other problems. So yeah, without that, without the specialists we have at Valley Children's Hospital, we would lose many kids.
Tell us how people can find out more information about what you're doing and all the other great things happening at Valley Children's.
So we're on social media all over the place. And you search Valley Children's Hospital, Valley Children's Healthcare, Valley Children's Medical Group. You'll have that. You'll be able to access that. Our main website is valleychildrens.org, and that will have all the events and the access for parents and other professionals and what we do and what the services we have available, how people can get to us. Valley Children's Pediatrics is our pediatric site for our primary care sites. And you see us occasionally in the papers and the articles and the like. We're kind of easy to find.
Thank you so much for coming.
Well, thank you for having me.
That's all for this edition of the Central Valley Ledger. We've been recording out of the beautiful downtown Fresno studios of the Community Media Access Collaborative Fresno Clovis. Our guest this week was Michael Goldring. He is the president of the Valley Children Medical Group. Thank you to the volunteer crew that made this production and every production possible. On the television side, it's Paul Starcevic and Alexander Trejo. On the radio side, it's Julie Logan, Brian German, and Jeff Davis. Thank you to those listening to this broadcast on KFSR 90.7 FM. And thank you to those watching this broadcast on Comcast 93 and AT&T 99. We hope you learned a little bit about some of the cool things happening in healthcare, especially for children. That's all for this edition. I'm your host, Sevag Tateosian. Tune in next week to a new edition.
KFSR and CMAC present the Central Valley Ledger every Sunday morning at 11:30. For a complete program schedule, visit kfsr.org.